we are fully aware and very appreciative in that we would not be where we are today without your support and passion and investment in us and allowing us to move forward with being able to do particularly what we love in our particular specialty areas. And, one more thing I'd like to point out is that when I started here full time, I was tasked with building or organizing an emergency and critical care service. And this July 1st, 2020 was actually our 10-year anniversary. So we are incredibly proud of that. And with your support and with the support of the community, we have just continued to grow by leaps and bounds within our service. And we're very proud of that. And we just are working really hard to strive and try to continue to provide the best care out there for all of our pets and our clients and their families. So some of the things that we're particularly excited about is just increasing our space, the availability of space to be able to triage more efficiently, have cases move forward in a much more efficient manner when they come through our emergency service. We'll have more accessible and better patient holding areas. We'll have incorporated procedure rooms that will be within the emergency area, so we won't have to spend time traveling the hallways, going to other areas of the hospital for certain things, particularly procedures that can be done within the ER. Having a separate entrance is going to be a really big thing for us as well, because it will be highlighted, lit very well during daytime hours as well as at nighttime. It'll be very easy for anyone to identify us and be able to come through our doors on the emergency side of the hospital for whatever the needs are for the pet at that time. We are excited to have a rounds room that will help facilitate teaching of our nursing students as well as our DVM students. And that room will be within our area, which helps also with efficiency and not having to spend too much time running the hallways and up and down and trying to find a quiet spot. So we're looking forward to that as well. The proximity of the emergency room as well as the intensive care unit and isolation and also intermediate care, all units that are staffed and operate 24 hours a day. And so keeping those things in a relatively close proximity for operations and staffing and all of those things is super important for us as well. We will have a new isolation unit, which will be great. We're super excited about that because it's been designed such that, and Dr. Parnell touched a bit on having individual pods, which will be really nice for safety and prevention of spreading infectious diseases between patients. Each patient would have their own bay, which would include a treatment area specific for that patient, as well as the area where they would be housed. The monitoring capabilities will be expanded for patients that have to be in isolation. There will be cameras installed. We're looking forward to, in the intensive care unit, expanding our monitoring capabilities as well. And we'll have telemetry. And so should there be a patient in the intensive care unit or in the isolation unit, we would be able to have them on telemetry and be able to monitor them closely via their EKGs that will show up on screens within various areas in the hospital. So we're really excited about that. We will have a separate intermediate care area, which will help tremendously for those patients who are recovering from more elective procedures and are not necessarily quite as critically ill as a patient that is in the intensive care unit and does need intensive monitoring. And so that's going to be a great help to us as well. And that will allow our staffing in the intensive care unit to really focus on the critical care patients. The intensive care unit's been designed such that we'll have areas to provide advanced care, such as ventilation therapy or high flow oxygen therapy, and those types of things without having to do it in the middle of the room, which sometimes unfortunately happens to us now, but we figure it out. I don't know that, obviously the hospital that we live in now was designed years ago, and I don't know that, you know, as visionary as we love to be and we are, that we would have ever predicted that our hospital will be where it is today, and headed down the path that we're very excited about going down. And so it's been a tremendous experience to be a part of that. And we're looking forward to being able to remain on the cutting edge and continue to do new and exciting things on all levels and in all areas of specialty. And for sure, having these new forthcoming accommodations is going to make a lot of that very possible for us. So we definitely, again, want to express our sincere thanks and gratitude to all of you that have supported us along the way and have the passion that we do, which allows us to do what we enjoy doing as well.